Hi, my name is Pepe Lu, and my project is on the regions of early brain overgrowth in children with autism. Let's start with some background. Autism spectrum disorder is a developmental disorder that results in impaired communication and social skills, and is caused by different combinations of genetic and environmental factors. Currently, there is no blood test, medical imaging, or genetic screen diagnostic for ASD. Monitoring a child's behavior is the only way to diagnose ASD. However, this method is subjective, and the child must be at least 2 years old for consistent, reliable diagnosis. Meanwhile, studies show that the earlier the therapy is started, the more effective it is, and studies have also shown that differences in brain morphology between autistic and normal children are detectable as early as 1 year old. The goal of this project is to review these morphological differences, and hopefully people can use this information, as well as MRI brain scans, to diagnose autism in infants. Several head circumference and MRI studies have mapped total brain volume from birth to adulthood. The general trend is that at birth, the ASD brain is the same or slightly smaller than normal brains. Then between 0 and 4, the ASD brain greatly increases in size. One paper has shown that 90% of autistic children between 2 and 4 years old have a brain volume that is above the normal mean. Then around age 6, there is a premature arrested growth followed by a decline in brain size. Further studies on this overgrowth period of development show that there is an 18% increase in cerebral white matter and a 12% increase in cerebral gray matter. From this chart, we can see significant increases in frontal lobe and parietal lobe white matter, as well as frontal lobe and temporal lobe gray matter. Here are a few other studies on gray matter volumes, and again we see the same general trend. Now what about gray matter surface area? A recent paper found that while the total brain volume growth rate is significantly higher in year 2, the surface area growth rate is significantly higher in year 1. This graph maps the degree of change in surface area between 6 and 12 months. They also implemented a machine learning algorithm to read these surface morphologies and identify whether or not a high-risk individual was positive or negative for autism. The program was able to identify between the two groups with 94% accuracy, 88% sensitivity, and 95% specificity. And finally, another interesting study looked at the corpus callosum morphology and found a significant difference in thickness at 12 months in the anterior portion of the corpus callosum especially. Furthermore, this difference is even detectable as early as 6 months. In conclusion, it is important to keep in mind that many of these studies used high-risk individuals who later tested positive for ASD as their ASD-positive group. As a result, brain development in autistic children with a low-risk background is likely to differ, especially due to the variety in genetic and environmental factors. However, it is promising that differences in structure can be detected as early as 1 year old. Hopefully, these discoveries can lead to diagnostics down the stretch. This concludes my presentation. Thank you for watching.